What is up, Sleep Tribe? Welcome to a brand new episode of the Healthy Sleep Revolution podcast. My name is Dr. Meghna Dassani, and it is my goal, especially in this new year. It has been for the past 11 years, but especially in this new year, to help all of us sleep better, breathe better. And the goal is to increase awareness so you know what you're looking for me to empower you as patients to improve the health of your families, of those around you, and even you, just by making sure you're getting to healthy sleep. So we're going to dive in today. And today I want to touch upon what is the ideal sleep position. Are you a back sleeper? Are you a stomach sleeper? Do you sleep on your side? Is there an ideal sleep position? And if so, what is it? So how we position our body when we are awake and also when we're asleep does affect our health, believe it or not. If you are one that experiences aches and pains, your posture might be to blame. And not just your posture, it's how you sleep at night as well. So, we've always been told, I know I was always told by my teachers, by my mom, to sit up straight, don't slouch. You've probably heard it at least once in your life, probably more. But good posture, isn't just about looking good or even about having good manners. Good posture can actually help reduce pain. It helps keep our joints and our muscles and our bones in alignment. And it also helps these muscles work more efficiently. So then the question, let me get to this. Good posture doesn't just affect how we hold ourselves when we're sitting or standing. This actually carries over into our quality of sleep as well. If you heard me before, if you are a listener of the Healthy Sleep Revolution podcast, if you are connected to me on social media, if you have read my books, I am constantly talking about our quality of sleep. And good posture does impact our sleep quality as well. And depending on your condition, whether you usually sleep on your side, your back, your stomach, your sleep position also has a huge role to play in this, and it does impact your health. So then the question arises, hey doc, what's the ideal position to sleep in? The ideal position to sleep in is one that does not cause pain, and it actually promotes good quality sleep. That is what we want to find out what it is that is going to help me feel good while I'm sleeping and when I wake up in the morning. Another point to keep in mind is if you have particular health conditions, such as sleep apnea, the position you sleep in can actually impact that as well. Your sleep position may factor into how it is impacting your sleep apnea as well. The sleep apnea impacts or can affect what your ideal optimal sleep position should be. So let's talk about sleeping on your stomach or in the prone position. Adults, I find, are least likely to sleep on their stomachs. And we see adults that we have conversations with regarding their sleep all day, every day in the dental practice. That makes up a huge portion of what I do. But many still do. It's not uncommon for me to come across an adult that says, Doc, I got to start on my belly. I can't fall asleep if I'm not on my stomach. Although sleeping on your stomach is actually the sleep position that is more likely to cause the most amount of discomfort or pain. Why? Sleeping on your stomach actually puts pressure on your spinal column. And this makes you more likely to experience neck pain, back pain, and you just wake up sore and stiff. Not a good feeling to wake up with. Another point to remember is sleeping on your stomach actually restricts your chest movements. This can make breathing more difficult. So if you're one that is stuffy, that has some kind of obstruction, maybe enlarged tonsils, if you sleep on your stomach, it might be harder to breathe. Pay attention. See what your body's telling you the next time you find yourself in a position that does not feel right in the morning. The next most common one is sleeping on your back or your supine position. This is actually the second most common sleep position. So if you have lower back pain, sleeping on your back can actually offer relief sometimes. And sleeping on your back is, as we've seen numerous beauty experts tell us, it is probably also the best position to avoid facial skin irritation, including wrinkles, through pillow contact, because we know that habitual contact with the pillow may contribute to the aging process. However, if you are one that has sleep apnea, sleeping on your back can make your snoring worse. It can make your acid reflux worse. And if you have sleep apnea, sleeping on your back is not recommended. That is one of the things I will address with patients that are in the chair, and we're talking about, yes, we're making you an appliance to help address your sleep apnea, or we are working in conjunction with your sleep MDs to help address the sleep apnea. This is one of the first things I will tell you. Do not sleep on your back because it can make your snoring worse. Because remember, when we sleep, our muscles relax, right? We've talked about this in previous episodes as well. Your body relaxes, your entire body relaxes, and this includes the muscles in the back of your throat. And all of that tissue then falls back, and it can possibly cause an obstruction, leading to obstructive sleep apnea. Your airway is more likely to become obstructed in this position when your muscles and tissues relax as we fall asleep and as we get into the deep sleep and REM sleep. And then there is sleeping on your side, be it your right or your left side. Everybody has preferences. This actually can have several benefits. Sleeping on your side is also the position that adults prefer to sleep in the most. Sleeping on your side is recommended. It's one of the things I will ask my patients to consider doing if they are snorers or if you have sleep apnea. This position promotes better airflow, as your airway is less likely to be obstructed by all the tissue in the back of our neck. Additionally, sleeping on our side relieves spinal pressure. So it can help get some relief or maybe even prevent that lower back and neck pain. Now, how do you determine whether you're going to sleep on your right side or your left side? Again, this can depend on what's going on with your particular situation. People that have heart failure, they might have an easier time breathing if they sleep on their right side. People with acid reflux might see their symptoms improve if they sleep on their left side. I know when I was pregnant with my girls, I was asked to, this was way before I even got into sleep apnea and went down the rabbit hole of sleep disordered breathing. My OB recommended, hey, try sleeping on your left side. It's going to help with blood flow and help you feel better. And yes, it did, because I didn't have all that excessive weight on my back. So it just depends on what is going on with your particular situation. As always, disclaimer, talk to your healthcare providers, talk to your doctors, your caregivers, your healthcare professionals that know what is going on with your particular situation. Another thing I would say is if you have acid reflux, you might want to place a foam pillow or a foam wedge under your mattress. It gives you that inclination, elevates your upper body. That can provide some relief as well. Remember, acid reflux, chronic, persistent, consistent acid reflux can be a sign of sleep apnea. Make sure you are addressing these concerns with your doctors, making sure you're bringing them up to speed rather than masking the symptoms with medications, okay? And I know I mentioned just a few seconds ago, sleeping when we're pregnant, how to sleep when you're pregnant. Easy peasy, find the position that feels most comfortable. Because if you're pregnant, if you had somebody in your life that is pregnant, was pregnant, you know it can be hard. It can be challenging to get comfortable. And typically, like I said, our doctors recommend you sleep on your left side. And this is because it does not put as much pressure on the vein that carries blood from the lungs to the heart. And this is going to allow the heart to pump more easily. More blood flow, easier blood flow, less work that the heart has to do while we are sleeping. Sleeping on the left side may also improve blood flow to the fetus. So if side sleeping is difficult, trying those pregnancy body pillows between the legs or on the small of their back, whatever will help to take the pressure away. So talk to your doctor. If you are unable to find your ideal, most comfortable sleeping position, if it does not feel right, if you don't wake up feeling rested and like a million bucks, talk to your doctor. Make sure you're having these conversations, not just with your doctor, but with your MD, with your dentist as well. Any healthcare providers that you see might be able to help you, might catch the clues that can help you to get a better night's sleep. As always, if you're snoring, if you're stopping breathing, if you are even concerned that you're not getting enough oxygen while you're asleep, talk to your doctors. See if a sleep study is right for you. Get sleep apnea ruled out, because that is a serious condition. We want to make sure everybody gets the best night's rest and sleep every night consistently. This does not need to be a one-off. This is something that should be our normal. And yes, if you're addressing your sleep disorders, be it your sleep apnea or upper airway resistance syndrome, or even the snoring, there are ways, there are adjuncts that can help getting there. And what is figuring out what's your ideal position to sleep can be a very good start. I hope this gives you some insight into what can help to help you get that good night's sleep. As always, hit that like button, hit that share button, and I will see you next time.